major thing, but Chrissy, I mean, she all.
It's a signature. I know. It's strategic, right? Undulating greens.
Good afternoon. We're going to wait a few more minutes. There's still more people joining the call. Good afternoon. Welcome to Nevada Medicaid's Justice Involved Reentry Initiatives public workshop. And I'm just going to do a few little introductions and go over some housekeeping. We have our federal waiver team here with us today. So I am Deidre Manley, and I am the manager over the federal waiver team. I see a lot of familiar faces on here, which is exciting. Amber Neff is one of the team members, and she's here presenting with me today. And Michael Gordon, our chief, is here as well today. And then we've got a couple other of our team members remote, which is Bernadette DeMars and Richard McFeely and Jonathan Figueroa and Minden Hall, who's also presenting the slides for us today. And Bernadette DeMars will also be keeping track of all the questions. And at the end of the presentation, we will go over the questions if they haven't already been answered in the slides that we're presenting. So just a few other housekeeping things to be aware of. We do have people joining by computer and phone and in person possibly. We don't have anyone in person yet, but they could show up. If you could use the chat box to submit any questions that you have and public comments, please include your name and your agency. This is being recorded and transcribed. And if you'd like a copy of the webinar and transcript, please reach out to our waiver team. And are the slides up? When they're presenting it? No. We'll have it on the slide. There we go. All right. So next slide, please. So if you do want a copy of this recording, you can find it there on, just reach out to our email address there, 1115 waivers. Public comment, if you have a question again, use the chat or raise your hand. But if you do put it in the chat, we are keeping track of all that and we'll go over it at the end. And if you're listening by phone, press *6 to unmute your line or *5 to raise your hand. And we will get started here. Next slide. All right. So today's agenda is for proposed state plan for Medicaid coverage of targeted case management for incarcerated adults and youth. We'll focus a lot on the youth today. Step-by-step overview of the Medicaid application process from a carceral facility standpoint, and we will have Department of Welfare and Supportive Services will be presenting that. And then just a review of the new billing guide for this set of services, which is available now, and we will show you where all that is located as well. All right, so a little overview of the CAA 5121. It's also known as the Consolidated Appropriations Act. And we will try to make sure we're aware of breaking down the acronyms that we use when we're presenting. So under the section 5121, the state will be required to provide the following services for eligible juveniles who are post adjudication and within 30 days of release from a public institution for inmates. This is effective as of January 1st of 2025. Certain screening and diagnostic services in accordance with early and periodic screening, diagnostic, and treatment, also referred to as EPSTD requirements, and targeted case management, TCM, 30 days prior to release and 30 days post. This applies to incarcerated individuals under the age of 21 who would not otherwise be eligible for Medicaid, and incarcerated individuals between the ages of 18 and 26 who would otherwise be eligible for Medicaid under mandatory former foster youth up to age 21 or up to age 26 if aged out of foster care. So that's an important area to be aware of. Sometimes people think, if someone's in jail, they're not considered a youth anymore, and CMS does consider them if they've aged out of foster care up to the age of 26. Amber?
All right. Listed in this table are our proposed Medicaid service manual updates for the 2500. We have currently a juvenile parole population and a juvenile probation services. They each get 30 hours per calendar month per recipient. We're adding in the eligible juveniles now, also with 30 hours per calendar month per recipient. Then only one target group can be built in that. One or the other, it can't be built for more than one. There we go. Thank you. Eligible juveniles is defined in 1902 in our Medicaid service manual update are individuals who are 21 years of age and determined eligible for any Medicaid eligibility group, or individuals determined eligible for the mandatory eligibility group of individuals aged out of foster care, aged 18 up to 26, immediately before becoming an inmate of a public institution or while an inmate of a public institution. These individuals who are within 30 days of their scheduled date of release from a public institution following adjudication and for at least 30 days following release. Next slide, please. Thank you. We're also noting the mandatory coverage per the Consolidated Appropriations Act. The state must indicate compliance with the 4 items below, that they are eligible juveniles as defined in the 1902 in the 30 days prior to release or not later than 1 week or as soon as practicable after release, screenings and diagnostic services, standards of medical and dental practice in accordance with the early and periodic screening, diagnostic, and treatment requirements, including a behavioral health screening or diagnostic service. in the 30 days prior to release and for at least 30 days following release. Targeted case management services include referrals to appropriate care and service available under the geographic region of the home or resident of the eligible juvenile, where feasible, under the Medicaid state plan or waiver of that plan. The state also acknowledges that a correctional institution is considered a public institution and may include prisons, jails, detention facilities, and other penal settings, for example, boot camps or wilderness camps.
All right, so again, we're breaking this down into covered services required by CMS, and then what our state has included to enhance these services. So the newly covered services, case management, so provided by embedded or in-reach staff during the pre-release period, and provided by a managed care plan or to be determined mechanism during the post-release period. Medicated assisted treatment, MAT, also known as MAT, in combination with counseling and behavioral therapies as clinically appropriate. And a 30-day supply of prescription medications in hand at point of release, consistent with Medicaid and SHIP state plan services coverage. And then coverage services included by DHCFP is physical and behavioral health clinical consultation services, prescription drugs during pre-release period, laboratory and radiology services, and services of a community health worker. Next slide, please. All right, our billing guide can be found in these locations, and this slide deck will be posted on our website, so you can go into it, but we're just going to open it up and show you. It is billing guide is posted. So this is what they look like. I'm going to give you a little information there. Thank you, Minden. And the website is easy. It's set up just for this, the Justice Involved Reentry program, so you can find everything on there, and we'll go over a few more of that, the areas that you might want to participate in as well. Thank you. Okay. All right, eligible facilities. So we are doing this as a phased in approach. So phase one is all state prisons and all state operated youth correctional facilities and county operated juvenile detention centers or youth camps. And phase two will be county operated jails that opt in, with jails can opt in over a 2-year period. So again, it gets a little, I know it gets a little confusing. I just want to point out here at the bottom, the CAA, the Consolidated Appropriations Act of 2023 requires all states to provide the screening, diagnostic, and case management services to Medicaid or CHIP eligible incarcerated youth who are post-adjudicated in the 30 days prior to their release to the community, and targeted case management services in the 30 days following the release. And then all facilities that house disposition CAA eligible youth will be mandatorily required to provide eligible youth in their facilities with required CAA services, the case management, screening, and diagnostic services that are also covered under the demonstration. And these facilities may, but will not be mandated to provide the full remaining scope of demonstration services. So for example, the MAT, the 30-day supply of medication upon release to youth and adults under the demonstration. Our eligible populations is the youth, so the Medicaid youth and SHIP eligible youth under the age of 21 or up to the age of 26 if aged out of foster care. And they do not have to have a behavioral health or a chronic condition criteria to receive these services. DHCFP is not proposing any changes to Medicaid eligibility standards in this demonstration application. And this is just a little overview to kind of show you what we've been doing. And there might be some of you wondering where it fits in, where adults are going over the age of 26 will fit in. So I can kind of break it down a little bit on here. So in January of 2025, we were awarded a CAA state planning grant to promote continuity of care for Medicaid and SHIP beneficiaries following incarceration. And that is a 4-year grant. And we applied and were awarded it. As of January of 2025, we are in negotiations on the reentry demonstration waiver with CMS, Center for Medicaid, Medicare Services. And we are anticipating June of 2025. We'll see where we are with that. The CAA launch and state plan amendment activities. So again, the CAA for youth is effective as of January 1st, 2025. And we hopefully will be done with some of the state plan amendment activities by April of 2025. And then development of reentry initiative implementation plan. Again, we're working on that and have been, and anticipate our end date would be in May of 2025. And then continued operational planning that is ongoing, and we hope to have a good plan in place by October of 2025. We have sent out information for our Nevada Reentry Advisory Committee, and it's also for the community to join, and we will give you the link on for our website if you would like to be a part of that. That is going to really help us with our operational planning to have people participate, ask questions. This is new to everybody, and we're learning from some other states as well. But we will provide that information. I'd encourage you guys to participate in that. And then CMS review of the implementation plan. They have it, and we're hoping May 2025, but we hope to go live in October of 2025, which would mean we would be able to start the reentry that covers adults and youth. So this youth with the 30-day period here would roll into what the state approved in the last legislative session for incarcerated individuals to receive services 90 days prior to release. And youth would still 30 days after, and then the adults can reapply. And we are in communication with Nevada Department of Corrections, jails, justice services, This has been ongoing. We've been touring all over the state. We have a contractor, Bill Teal, here with us that has done an amazing job getting us connected, and we're going in the jails and meeting with people. And I see hands clapping there. And so again, we're here to partner and learn. This is new for us. It's new for you. And we would, welcome anybody that wants us to come present or come meet with them or come to their facility. And I'm going to pass this on now to Division of Welfare and Supportive Services. Heather Kohler is going to present.
Hi, my name is Heather Kohler. I am a social services program specialist with the State of Nevada Division of Welfare and Supportive Services. We're going to show the training program for the carceral facilities that goes over the application and the addendum. It's the Justice Involved Application Addendum for the Reentry programs. Amy Craffer is going to go ahead and play that program for you right now. And we'll go ahead and watch that, and I'll answer any questions that you may have after it. Thank you.
Welcome to the presentation on the Medicaid application and addendum for justice-involved individuals. This presentation will address the following key topics. 1. How to complete the Medicaid application for justice-involved individuals. 2. How to complete the Medicaid addendum for justice-involved individuals. 3. Review of the eligibility requirements for justice-involved individuals. 4. Review of the application and addendum submission timeframes. The Medicaid application for justice-involved individuals must be completed by those applying for medical assistance through Medicaid or Nevada checkup while currently incarcerated. Eligibility for Medicaid and/or NCU will first be assessed under an available reentry program. Juveniles can be potentially eligible for pre-release services starting 30 days prior to their release date and for at least 30 days following their release. Applications for assistance may be submitted up to 120 days before the scheduled release date. Individuals who do not qualify for a reentry program may still be considered for placement in Medicaid NCU suspended status program if they meet all other eligibility criteria. Individuals who do not qualify for Medicaid NCU will receive a denial notice. Let us now review the Medicaid application process for individuals involved in the justice system. On the initial page of the application, you will find the criteria for determining eligibility for the reentry Medicaid coverage and suspended Medicaid programs. Before completing the application, please verify if the individual qualifies for either the reentry Medicaid coverage or the suspended Medicaid programs. The eligibility requirements for the reentry Medicaid coverage are as follows. Juveniles who meet the eligibility requirements for release may qualify for the reentry program, which provides assistance starting 30 days before their release date. Carceral facilities must confirm that the individual meets these requirements by submitting a completed DWSS Form 2971, Justice-Involved Medicaid Transition Request to DWSS. The eligibility requirements for the suspended Medicaid program are as follows. If found eligible, the individual's Medicaid eligibility will be suspended until their release from the carceral facility or until their circumstances change, resulting in ineligibility for Medicaid or Nevada checkup. The requirements for the 30-day pre-release for juveniles encompass both non-financial and financial eligibility factors. We will explore these factors in greater detail during the training session. The age criteria for juveniles extend up to 19 years old. Juveniles aged 19 and 20 may qualify for childless adult eligibility, and former foster care youth up to age 26. When assisting the applicant with the application process, ensure that all available information is entered accurately. Let us begin with the applicant information field. The applicant or authorized representative must provide the inmate's full legal name, date of birth, incarceration status, and the expected release date of the incarcerated youth. Next, enter the facility name and address, including the physical location of where the incarcerated youth is housed. Provide a mailing address, which can be that of the facility or the applicant's choice. The applicant may also enter a contact number for the facility, or another number of their choice, including a secondary number if available. Enter the language of the inmate, if their preferred language is other than English, and designate if an interpreter is needed. Please provide an email address, which can be that of the facility or the applicant's choice if available. DWSS requires the Social Security number or tax identification number of the incarcerated youth. Provide the inmate's marital status, pregnancy status, gender, and lastly, attest to whether or not the inmate is legally blind or permanently disabled. The following section of the application addresses the tax filing status of the applicant. The incarcerated youth must indicate whether they will be filing taxes or will be claimed as a dependent in the upcoming year. In the example provided, the applicant has stated that they will be claimed as a dependent by their parent. To be potentially eligible for medical assistance, an applicant must be either a United States citizen or a qualified non-citizen. If the applicant is a qualified non-citizen, they must specify their category, such as a legal permanent resident, an asylee, a refugee, and so forth, and provide their alien number in the identification number field. The following question inquires about military service for the applicant's spouse, domestic partner, and/or parent. This information is necessary to assess whether the applicant may be eligible for military benefits. In the current income information section, the applicant must confirm all sources of income they are receiving. This includes any funds received by the inmate for commissary purchases. If the applicant has any source of income, they must specify the type of income, the gross amount received, and the frequency of that income on the application. The eligibility team will request verification of the reported income to assess the applicant's potential eligibility for medical assistance. We will now review the race and ethnicity of the incarcerated youth. Applicants who identify as American Indian or Alaskan Native and become eligible for Medicaid or Silver State Health Insurance can also receive Indian and tribal health services. Please ask the applicant to indicate if they are American Indian or Alaskan Native. If applicable, they must provide their tribal affiliation. If the applicant identifies as Hispanic, Latino, or of Spanish origin, please have them indicate their specific Hispanic heritage. Although optional, applicants are allowed to identify their race. In the health insurance information section, the applicant must confirm whether they currently have health insurance, as Medicaid is the payer of last resort. If applicable, the applicant must specify the type and name of the health insurance they are currently receiving. DWSS is committed to non-discrimination. In accordance with federal law, discrimination based on race, color, national origin, sex, age, sexual orientation, gender identity, or disability is strictly prohibited. Applicants are encouraged to report any incidents of discrimination. Complaints can be filed online, by mail, by phone, or via email. In the following 3 sections, we will cover essential information about Medicaid assistance. The Medicaid Estate Recovery Program applies to Medicaid recipients aged 55 and older, as well as those who are inpatients of a medical facility. These individuals may be required to repay Medicaid expenses incurred on their behalf. The recovery of these payments will be sought from the recipient's estate after their death or the death of their surviving spouse. Third-party liability is a crucial eligibility requirement for receiving Medicaid benefits. Applicants must understand that if anyone listed on this application receives Medicaid benefits, they grant the Medicaid agency the authority to pursue and collect any funds from other health insurance, legal settlements, or any other third parties that may be liable for the medical services covered by Medicaid. This includes the right for Medicaid to seek child and medical support from a spouse or parent. Additionally, applicants must agree to cooperate and provide information regarding any legal settlements or legal actions to the Medicaid agency to facilitate the recovery of funds from third-party sources. The Department of Health and Human Services, DHHS, reserves the right to review and investigate all information submitted in the application. Applicants should understand that by applying, they authorize DHHS to conduct investigations regarding themselves, other household members, and the legal or natural parents of the applicant's children as necessary to assess eligibility for benefits. The information provided may be verified by federal, state, and local officials, including quality control staff. Applicants must comply with these terms to be considered for benefits and to maintain them after approval. Any failure to cooperate or provision of false information may lead to repayment obligations and potential criminal prosecution. The DHHS, Department of Health and Human Services privacy policy, mandates the protection of your information by law. The details submitted in your application will solely be utilized to assess your eligibility for medical health coverage. DHHS will access information through electronic databases from state and federal agencies, including the Internal Revenue Service and the Department of Homeland Security, as well as other consumer reporting agencies. This information is essential for determining your medical eligibility. If there is a discrepancy between the information you provide and that obtained from our electronic databases, you will be required to submit additional information to resolve the conflict. Understanding this policy and granting your consent will facilitate your eligibility determination without unnecessary delays. The Department of Health and Human Services, DHHS, offers an optional text messaging system. This system enables your assigned managed care organization, MCO, to inform you about important information related to your healthcare needs and treatment, wellness services, plan benefits, eligibility, renewal, and redetermination. Additionally, it facilitates other communications regarding your relationship with DHHS or the MCO concerning your health coverage. You may receive calls and texts from both automated technology and customer service representatives. Please note that standard message and data rates may apply. The Health Plan Selection section outlines the coverage options available for individuals residing in urban Washoe and Clark counties under a managed care organization, MCO. Incarcerated youth will have the opportunity to select one of 4 MCO plans specifically available to residents of these urban areas. The available options for healthcare coverage are Anthem Blue Cross and Blue Shield, Molina Healthcare, Silver Summit Health Plan, and United Healthcare Health Plan of Nevada. Inmates living in rural areas outside of Washoe and Clark counties will continue to receive the Medicaid fee-for-service plan, commonly referred to as straight Medicaid. If no selection is made, a random algorithm will assign an MCO plan. It is important to note that choosing a plan does not guarantee enrollment in the Nevada Medicaid or Nevada Checkup programs. Additionally, if the inmate or any household members are already enrolled in a specific MCO plan, they may be restricted from switching to another plan. Upon approval, incarcerated youth will receive further details from the MCO plan through a member handbook. The incarcerated youth or their authorized representative has the right to ensure the accuracy of the application determination. If the applicant believes there has been an error in the medical determination, they have the right to appeal and can request a re-evaluation of their medical case. Additionally, the incarcerated youth or their authorized representative is responsible for reporting any changes during the approval period. All changes must be reported by the 5th day of the following month. Applicants should be aware that any reported changes may affect their current eligibility status. The applicant must provide authorization for the release of information to the Department of Health and Human Services. Additionally, The applicant must release the information holder from any liability that may arise from the disclosure of the required information. If the applicant is over the age of 18, they are required to sign and date the application. This step is essential for validating the information provided, as it serves as an attestation from the incarcerated youth or their authorized representative. If the applicant cannot sign due to an inability to read, write, or being blind, a witness must provide their signature and date. This witness should have read the application information to the applicant and observed the applicant's signature or marking. Finally, on page 4 of the application, this section outlines where to submit the application and any supporting documents. It is essential to ensure that the applicant and/or authorized representative signs the application. A disclaimer notice has been included to inform the incarcerated youth or authorized representative that upon release from the public institution, they must provide their intended residence address. This requirement ensures that important documents, Medicaid cards, and any additional information are sent to the correct address. Individuals who are 17 years old or younger are not permitted to sign the application themselves. For a minor child aged 17 or younger, when a parent or guardian is not available to sign and submit an application on behalf of the minor child who is incarcerated, the carceral facility has the authority to complete and submit the application and designation of authorized representative form on behalf of the minor. The Statement of Designated Representative section is to be completed by the designated carceral facility staff member with their name, position, title, and date. All facility information, including address and telephone number, must be provided. If an individual aged 18 and over designates an authorized representative who is not present at the time of application, a designation of authorized representative form 2525-EE must be sent. This form must be completed by both the applicant and the designated authorized representative. The designated authorized representative is required to provide their contact information and signature to confirm their agreement to act as the incarcerated youth's authorized representative. This process does not stop the application process. However, in order for the designated authorized representative to be valid, the form must be returned to DWSS as soon as received. When the applicant is aged 18 or older and wishes to appoint an authorized representative, they must also complete the designated section of the application. This includes marking yes and providing the name, contact information, and address of the authorized representative. The applicant must then sign and date the application to confirm their selection. As previously mentioned, an applicant aged 17 or under must have a designated authorized representative to apply on their behalf. If no parent or guardian is available at the time of application, the carceral facility may apply on behalf of the applicant and designate themselves as the authorized representative for the juvenile. Under the first section titled Designation of Authorized Representative is the designation of the facility section. This section outlines the criteria for designating the facility as the representative. This facility designation should be completed under the following circumstances. A. When the incarcerated youth is 17 years old or younger and has no available guardian or parent, the facility will be designated as the representative and will complete all section fields, as the carceral facility has the authority to complete and submit the application and designation of authorized representative form on behalf of the minor. Or B. When the inmate is 18 years old or older and has chosen to designate the facility as their representative. If the applicant inmate aged 18 and over wishes to designate the facility as their authorized representative, both the applicant and the facility staff member must complete and sign these sections. The incarcerated youth aged 18 or older will print their name, facility name, and then confirm their authorization of the facility as either the primary or secondary representative by signing, along with their birth date and the date of signing. A staff member from the facility will then indicate their agreement to serve as either the primary or secondary representative by signing and printing their name. They will also provide their position, the date of signing, the facility's location, contact number, and the name of the facility. Upon the release of an incarcerated youth from the facility will cease to be the authorized representative of the applicant. The justice-involved application. Addendum Attestation of Eligibility for Reentry Program. Form 2971, Form 2971-EE must be completed by the carceral facility or their authorized signatory, healthcare professional, as an addendum to the Medicaid application for justice-involved individuals Form 2970. This form serves as an attestation from the carceral facility, signatory or healthcare professional regarding the inmate's eligibility for a reentry program. It confirms whether the inmate qualifies for the program based on the criteria specified in the Nevada Revised Statutes 422.2722428. If an inmate who was initially eligible for the reentry program becomes ineligible due to unforeseen circumstances, Form 2971 is used to change their Medicaid status to suspended, as they no longer qualify for the program. The Form 2971-EE must be utilized each time a request for the reentry program or to suspend Medicaid. Let us now review the Medicaid addendum process for individuals involved in the justice system. The Justice-Involved Application Addendum. Attestation of Eligibility for Reentry Program. Form 2971 must be completed with each application submission. Additionally, if an applicant is currently receiving reentry Medicaid assistance and their original release date has been extended, or if other circumstances arise that affect eligibility, Form 2971 must be submitted to suspend the current Medicaid eligibility. The facility staff member will provide the juvenile's legal last and first name. Please enter the juvenile's Social Security number or tax identification number. List the juvenile's date of birth and gender. If available, provide the inmate's Medicaid billing number. Enter the current address of the inmate. Indicate the inmate's current Medicaid status by selecting one of the following options: none, suspended, or unknown. Facility medical staff should have access to the eligibility verification system to verify if an applicant is currently receiving Medicaid. In the second section of the addendum, the authorized signatory and/or healthcare professional will attest to the inmate's eligibility for the reentry program or request the suspension of current reentry Medicaid eligibility. They must provide the release date of the incarcerated youth. It is important to note that when an incarcerated youth qualifies for the reentry program, they can receive pre-release services 30 days prior to their release date. An application can be submitted as early as 120 days before their release date. If circumstances change while the applicant is receiving the re-entry pre-release services while in their 30-day eligibility, and they become no longer eligible and/or their release date has been extended, you can request that the medical assistance be placed in a suspended status by providing the effective date of suspension. For example, if we submit an application on February 1st, 2025, for an incarcerated youth set to be released on April 1st, 2025, DWSS receives the application, addendum, and all required verifications to process the inmate. The incarcerated youth becomes eligible for the re-entry program on March 1st, 2025, to receive their 30 days of pre-release services while incarcerated. On March 5th, 2025, the incarcerated youth's circumstances have changed, and their release date is now pushed to November 1st, 2025. Submit another Form 2971 to request the incarcerated juvenile be returned to a suspended Medicaid status, effective April 1st, 2025. As outlined in the review of the application process, please follow the same steps when completing the designation of the authorized representative section in the addendum. If an individual aged 18 and over designates an authorized representative who is not present at the time of application. A designation of authorized representative form 2525-EE must be sent. This form must be completed by both the applicant and the designated authorized representative. The designated authorized representative is required to provide their contact information and signature to confirm their agreement to act as the incarcerated youth's authorized representative. This process does not stop the application process. However, in order for the designated authorized representative to be valid, the form must be returned to DWSS as soon as received. When the applicant is aged 18 or older and wishes to appoint an authorized representative, they must also complete the designated section of the application. This includes marking yes and providing the name, contact information, and address of the authorized representative. The applicant must then sign and date the application to confirm their selection. As previously mentioned, an applicant aged 17 or under must have a designated authorized representative to apply on their behalf. If no parent or guardian is available at the time of application, the carceral facility may apply on behalf of the applicant and designate themselves as the authorized representative for the juvenile. Finally, in Section 3, the authorized signatory and/or healthcare professional must print their name, title, and NPI number. They are required to sign and date the addendum, as well as provide the facility's address and contact information. As previously stated in regard of the application process, for a minor child aged 17 or younger, when a parent or guardian is not available to sign and submit an application on behalf of the minor child who is incarcerated, the carceral facility has the authority to complete and submit the application and designation of authorized representative form on behalf of the minor. The Statement of Designated Representative section is to be completed by the designated carceral facility staff member with their name, position, title, and date. All facility information, including address and telephone number, must be provided. As previously mentioned in the review of the application process, the same steps should be followed when completing the designation of the authorized representative section of the addendum. Any juvenile applicant aged 17 and under must have a designated authorized representative, either from the facility or another individual aged 18 or older. If any individual designates an authorized representative who is not present at the time of application, a designation of authorized representative form 2525-EE must be sent. This form must be completed by both the applicant and the designated authorized representative. The designated authorized representative is required to provide their contact information and signature to confirm their agreement to act as the incarcerated youth's authorized representative. If the applicant is aged 18 or older and wishes to appoint an authorized representative, they must complete the designated section of the application. This includes marking yes and providing the name, contact information, and address of the authorized representative. The applicant must then sign and date the application to confirm their selection. As outlined in the review of the application process, please follow the same steps when completing the facility designation for the authorized representative section of the addendum. Under the first section titled Designation of Authorized Representative is the designation of the facility section. This section outlines the criteria for designating the facility as the representative. This facility designation should be completed under the following circumstances. A. When the incarcerated youth is 17 years old or younger and has no available guardian or parent, the facility will be designated as the representative and will complete all section fields, as the carceral facility has the authority to complete and submit the application and designation of authorized representative form on behalf of the minor. Or B. When the inmate is 18 years old or older and has chosen to designate the facility as their representative. If the applicant inmate aged 18 and over wishes to designate the facility as their authorized representative, Both the applicant and the facility staff member must complete and sign these sections. The incarcerated youth aged 18 or older will print their name, facility name, and then confirm their authorization of the facility as either the primary or secondary representative by signing, along with their birth date and the date of signing. A staff member from the facility will then indicate their agreement to serve as either the primary or secondary representative by signing and printing their name. They will also provide their position, the date of signing, the facility's location, contact number, and the name of the facility. Upon the release of an incarcerated youth from the facility will cease to be the authorized representative of the applicant. Once you have completed the application and addendum in full, please scan and attach them along with any supporting documents to JusticeMed at dwss.nv.gov. Ensure that you include application submission in the subject line. Alternatively, you may fax the documents to 702-631-3387. If you need immediate virtual assistance, please include Justice-Involved Assistance Request in the subject line of your email to ensure proper vetting. For returning requested verifications or additional documents for the inmate, please use Verification Submission in the subject line, as well as ensuring the inmate's name and case ID from the corresponding insufficient information form are included in the body of the email and all documents are attached. This will help us prioritize emails effectively. It is essential to complete both the application and addendum thoroughly to ensure a valid submission. If any information, such as demographic details, contact information, or signatures, is missing or invalid, the application may be returned to the facility, causing delays in processing time. Upon submission of a valid application and addendum, certain information may necessitate a request for verifications. An insufficient information form 2429 will be sent to the provided mailing address. Verifications must be submitted by the due date listed on the insufficient information form. The incarcerated youth may use the facility address for mailing to expedite the verification process to DWSS. Effective communication among the facility, the inmate, and the parent or guardian is essential. It is crucial to provide daily updates on the release dates of upcoming inmates. Any changes regarding release dates, income, household composition, address, and similar matters must be reported by the 5th of the following month. However, reporting this information sooner will expedite the case review process. Facility staff and/or the parent or guardian can use Form 2584-EG to report these changes. It is vital that once the incarcerated youth is released, both the inmate and the authorized representative report the current mailing address. This is necessary for issuing a new Medicaid card, a new notice of decision letter, and any other important healthcare information. Now that we have thoroughly reviewed the application and addendum for justice-involved individuals, let's go over some important reminders. 1. The Reentry program provides pre-release services to incarcerated youth 30 days prior to their release date and 30 days following their release. 2. Suspended Medicaid is applicable when incarcerated youths are receiving medical assistance, but their circumstances have changed, necessitating a suspension of their current Medicaid eligibility. 3. The Justice-Involved Application Addendum. Attestation of eligibility for Reentry Program Form 2971 must accompany every application for the Reentry Program, as well as whenever there is a change in an incarcerated youth's current reentry status or suspended Medicaid status. 4. Ensure that the application and addendum are fully completed. 5. Ensure that any juvenile minor applicant aged 17 and under has a designated authorized representative who can apply and designate themselves as the authorized representative on behalf of the juvenile minor applicant. 6. If any incarcerated youth aged 18 or older designates an authorized representative other than their current facility, the designated individual must complete the designation of an authorized representative form 2525EE, which must be signed by both the inmate and the representative. 7. When submitting an application, documents, or requesting information that you utilize the email justicemed@dwss.nv.gov or fax number 702-631-3387. 8. If further information is needed to process the application and addendum, the Insufficient Information Form 2429 will be issued. Verifications must be submitted by the due date listed on the Insufficient Information Form. 9. Finally, any changes that occur after the application and addendum process has been completed, the submission of Change Report Form 2584EG will be required. This form must be submitted by the facility if the change happens while the inmate is currently housed, or by the juvenile minor's parent guardian, authorized representative, and/or by the incarcerated youth aged 18 and older, along with their designated authorized representative if applicable. Thank you for viewing this presentation. For further information, please email justicemed@dwss.nv.gov.
Okay, thank you, Amy. Sorry, I know it was a lot of dry information, but important information for the facilities on how to complete the application changes and submit the attestation form. Does anybody have any questions on that? No? Okay, so that will be posted on DHCFP's website and Nevada eLearn for easy access to take the class. Thank you.
Thank you, Heather. Okay, we are going to wrap this up a little bit. And our next slide is just going to provide some additional resources that we went over a little bit before, but our advisory committee, our kickoff meeting is Tuesday, March 25th, and this is virtual. It's from 12:30 to 1:30. And we will then plan out when we will continue to have those. We're going to hold them every other month initially, and then we'll do them quarterly. But your attendance in those and participation is really vital to helping us get this going and taking on this big project. And we're looking for people in the advisory committee from, people with lived experience, family members, professionals, any kind of support. So people from our sister agencies. So please try to join us if you can. And then we do have a very informative flyer that you can also pull up and print out with QR codes on there, and goes into some of the bullet points that we presented here today. We also have our listserv, so you can go on there, and when these slides are posted, you can sign up for the notifications and just scroll down to the Justice Involved Reentry Initiative heading. And then our website, our Justice Involved Reentry Program, and the DHCFP waivers homepage as well. And we will open it up now to any questions that you might have from our federal waiver unit on our presentation, or any other questions that you might have. And I think Bernadette's looking at any of the questions that might have been posted when we presented.
There are no questions in the chat right now.
It looks like Frank has his hand up.
Yes, hello, everybody. I was curious to learn if there was any idea what the state plan amendment for these services was planning to look like that we were going to submit to the federal government.
Yeah, I apologize. It was sort of the same as it was stated as our change in the MSM. But yes, we can post that along the state plan amendment change along with these slides will be available after our meeting.
Excellent. Thank you.
There's a question from Marshall. How much funding for the program is dependent on federal funding?
I do not have that answer in front of me. We can definitely try to research that and provide that.
Iman has her hand
This
up.
question from Alex, will there be any opportunities for city jails to join the demonstration?
Yes, there will. As we get into phasing in the demonstration project for the 1115 waiver, we will be including jails in that process. So phase 2 was the rural county jails and city jails. And then
Stop. Iman.
Iman.
Inman.
Yes, ma'am. That's okay. I'm Amon Stallworth, Justice Liaison for Molina Healthcare. Fee for service. Molina's connected with the coordinators out there at the prison, and the problem we're running into is that when they're released from prison and come to come to Las Vegas, they're still fee for services, and we cannot really connect with them right then and there because they're fee for service. And although we do take them to the closest DWSS office to have it changed, have them pick which MCO they would like to have, will they be changing? Will they be able to pick a MCO before leaving prison?
That is the intention, but we do know that it is a choppy process, and we realize that, and we've been having we are working with DWSS and trying to figure out how to fix that challenge. Of course, all Medicaid eligibility is based off of a monthly basis and not on a daily basis, so that does create some of the issue, and so we are looking at ways to improve that process as we go forward. But we are working on doing more warm handoffs between the stay at jail and the case management afterwards.
There was a follow-up from Marshall from his initial question on the federal funding, if it's in light of the recent executive orders.
Melinda, can you address that? I'm sorry.
I'm sorry, Michael, can you repeat the question?
So the original question from Marshall was how much funding for the program is dependent on federal funding, and his follow-up is in light of recent executive orders. Has that changed?
It has not changed to our knowledge. Thank you.
I don't see any further questions in the chat.
Okay, thank you, Bernadette. Thank you, everybody, for attending and participating and asking some great questions. And I hope to see you at our advisory committee kickoff meeting. And please reach out if you have any questions. Thank you.
Thank you, everyone.
Thanks, everybody.
Thank you.
Thank you.